CRNBC scope of practice for registered nurses. So what I'm going to be doing is going over the scope of practice for registered nurses based on the CRNBC publication. If you go on the crnbc.ca website and click on the RN nursing standards, you'll see a document, a link for scope of practice for registered nurses, standards, limits, and conditions, and that's the basis of this video. Beginning with the regulations for RNs as well as nurse practitioners. So the CRNBC document talks about what the regulation covers. Basically what it covers initially, based on the document, is that nurses, registered nurses, and nurse practitioners are reserved titles for nurses, as well as it talks about a scope of practice statement and restricted activities for RNs and nurse practitioners. The term scope of practice, basically what that term is, it is an indication, or it indicates what RNs and nurse practitioners are educated and authorized to perform. For example, assessments and administering and implementing any interventions, as well as evaluating your interventions. So basically what the nursing process is. So these activities that are included in the scope of practice of RNs and nurse practitioners are determined by the legislated definition of nursing practice through the CRNBC standards, limits, and conditions. CRNBC states that if you are registered of CRNBC, you're able to practice nursing in terms of healthcare promoting, maintaining, and restoring health, as well as prevention, treatment, and palliation of illness and injury, primarily by assessing health status, planning and implementing interventions, as well as coordinating health services. Restricted activities are activities that could cause potential harm or significant risk to harm for the public. So that's why the activity is deemed restricted, and it's only for healthcare professionals, so RNs, that have further training or for specific health professionals. So we're only permitted to practice within that scope, except for two exceptions that they've highlighted within the scope of practice for registered nurses document. And those two exceptions are in life-threatening emergencies, in which we as RNs are ethically obligated to provide care, the best care that we can provide, given that the circumstances and our individual competence permits us and allows us to do so, in terms of what the circumstances are, or what the events occurring are in this life-threatening emergency. The second exception to the rule of just practicing within our scope of practice is whether a formal delegation process is in place, and we'll talk about that later on as well. In terms of our scope of practice, there's standards, limits, as well as conditions. When they say standard, they define it as a desired and achievable level of performance against which actual performance can be compared. It provides a benchmark below which performance is unacceptable. So sort of a bar that you have to maintain to make sure that you are providing adequate care, and that would be considered a standard. In terms of limits, the CRNBC defines limits as what registered nurses are not permitted to do. For example, RNs are not, it looks like what they used as example here is they may not carry out endotracheal intubation. And we would have that insight due to not having that competence through our nursing practice, through our education as well. They also talk about conditions, and the CRNBC defines conditions as sets out the circumstances under which RNs may carry out an activity. For example, RNs must successfully complete additional education before carrying out conservative sharp wound debridement. So if you were a wound care nurse, you would have to go through additional education, higher level education like conservative sharp wound debridement, to be able to perform that activity. Other examples could be IV insertion. You would need to be in service and provided education to be able to initiate intravenous initiation or access. For controls on our nursing practice, the CRNBC identifies 4 of them. The first one, Registered Nurses and Nurse Practitioners Regulation, which sets out the scope of practice in fairly broad strokes. The second one, the CRNBC Standards, Limits, and Conditions, which complement and further define limit the scope of practice sets out in regulation. So if there's a question in terms of what your scope of practice are, whether you're practicing within standards or limits, or if you have a question of whether you can administer that particular intervention, you can go to the CRNBC website and check out the standards, limits, and conditions to make sure that we're practicing within our scope of practice. As well, different employer policies which may restrict registered nurses' practice in a particular agency or nurse or unit. So in this case, for example, in one hospital, RNs may be a part of their scope of practice is to discontinue or remove a chest tube, whereas if you go to a different, that one RN that has been removing chest tubes goes to a different hospital and starts to work there, that scope of practice or expectation might be different in that that's restricted to physicians or nurses that have had their own in-services pertaining to that specific authority or health authority. Another control nursing practice that CRNBC has identified is the individual registered nurse's competence to carry out a particular activity. So that calls upon the RN's accountability as well as responsibility to make sure that they're practicing within their own competence to carry out whatever activity that they need to, and being able to access resources and different referrals to ensure that one, that RN is practicing within their own scope of practice and competence, or two, being able to look for plan Bs or what they can do if they are, or if they're not able to practice within that scope. There's 3 different practice regulations within the CRNBC RN scope of practice. The first one is the general practice, which is what we practice as RNs, as general RNs, especially as new graduate RNs, and that's just practicing within the general scope of practice. On a higher level of education, there's certified practice in that the nurses are able to perform higher level tasks and skill sets, for example, diagnosis of STIs and administration of intervention. Or there's also the third one, which is nurse practitioner practice, in that you need another higher level of education in the master's level and maintained through nursing practitioner scope of practice. So if we have a look at the document that the CRNBC has published in terms of the scope of practice, the CRNBC talks about activities that are not restricted to general, that are not restricted, that general practitioners, nurse general practitioners, are able to practice. So these activities they've listed on part 2 of activities that are not restricted. I won't go over the entire list here, but if you like, you can go over to the standard resources scope of practice for registered nurses. But some of these activities that we are permitted to perform are things like assisting clients with ADLs, carrying out ECGs, communicating with clients, collaborating with other healthcare members, counseling, mentoring and preceptoring other nurses and student nurses. We can pronounce death of a client, things like taking a swab, teaching, using isolation techniques. So quite a few activities that we are permitted to perform. If you do have any doubts or questions of whether you are allowed to perform that activity, you can access this document and you are able to clarify that and determine whether that is within your scope of practice. There are some non-restricted activities that we can perform as RNs, which do not require certified practice or nursing practitioner practice. However, they do have limits and conditions tied to them to ensure that they are carried out in a safe in a safe manner. So these limits and conditions are on activities that have a particular risk for harm for the client. So one of those things that the CRNBC has identified is the cardiac stress testing for the purposes of diagnosis and treatment planning. It has a significant degree of risk to the client, but it is not restricted and we can perform it. And we can only perform with a doctor's order. The other one is emergency contraception using levonorgestrel in the provision of reproductive health care to women. Some preparations of levonorgestrel are now in Schedule 3, and dispensing administering is not a restricted activity. However, this activity is new for RNs in general practice. So these documents are all, and our scope of practice is constantly changing with the constant demand in different shifts and responsibilities between MDs, RNs, as well as LPNs, and being able to make sure that we are updating ourselves and making sure we're current in our current scope of practice is important. So it's critical that we consult the scope of practice for RNs with the CRNBC publication here. There's limits and conditions to a few of much of our practice as well. There is a practice that we can perform, and it's acting without an order, providing interventions without a doctor's order. And the limits and conditions that are applied to practice such as this is being able to use your critical thinking and judgment, and making decisions about performing the activities that are restricted as well as non-restricted without an order from another healthcare professional like an MD. So when acting without an order for RNs, I'll just read through the CRNBC standards for acting without an order, just to make sure that this is clear, especially when we are practicing in acute care and resources might be limited. So CRNBC standards for acting without an order. Before carrying out any activity without an order, registered nurses, number one, accept sole responsibility for determining that the client's condition warrants performance of the activity. So we have to make sure that it's warranted, that the client needs it to be able to promote health and maintain well-being. Number two, assess the client's status and make a nursing diagnosis of a client condition that can be improved or resolved through nursing activities. Number three, ensure that the activity is within the scope of practice for RNs as set out in the regulation that we've described. It's congruent with any limits or conditions established by the CRNBC, and within any restrictions imposed by organization policy. Number four, interpret and use current evidence from research and other credible sources to support both the activity and the decision to carry it out. Number five, have the competence to determine whether the client's condition warrants performance of the activity, having considered the known risks and benefits to the client, predictability of outcomes of performing the activity, other relevant factors specific to the situation. We should have the competence to carry out the activity safely and ethically, and manage the intended and unintended outcomes of the activity, having considered the safeguards and resources available in the circumstances to safely manage the intended and unintended outcomes of performing the activity. And six, obtain the client's consent. Now, one of the examples that I might see for standards without acting in order is if we have a client who's fresh post-op, who has received a large amount of opioid analgesics, and we see, based on our assessment and critical thinking and judgment, that the respirations are going down, meaning that they may be going to respiratory distress or respiratory arrest, and we can, based on our assessment, administer naloxone to without an order to ensure that we are maintaining a quality of life as well as promoting health and well-being. Given that patient does not have a do not resuscitate or do not administer CPR order. So in that case, we are ensuring that we're following all the standards that are indicated for acting without an order, and performing and acting within their scope of practice. So in terms of restricted activities that do not require an order, the CRNBC has set out standards, limits, and conditions, and you can find this in Section 6 of the publication by the CRNBC. So the CRNBC states that to carry out these restricted activities, RNs do not require an order from another health professional. They are, however, required to adhere to standards, limits, and conditions set by the CRNBC. So the CRNBC talks about different examples that are that we're able to diagnose with nursing diagnosis as well as treat. And the conditions they talk about are hypoglycemia. So we would be implementing different interventions to offset the hypoglycemia that's occurring, secondary to the patient's primary diagnosis that the patient might already have type 1 diabetes. For urinary retention, we would also implement interventions such as a Foley catheter or constipation related to medication. Others require stabilization until the physician can diagnose and treat the underlying disease. So a condition that might be new, we can treat the condition that's occurring or is concurrent to what's currently occurring with the client. So severe bleeding or hypoxia, and the reason for severe bleeding may be a GI bleed that's happening within the client, but rather than identifying that this is the diagnosis, we can treat what that is based on the client's signs and symptoms. The CRBC says other examples of conditions that are diagnosed and treated by RNs include anaphylaxis, constipation related to some diets, some wounds, minor second-degree burns, and foreign objects in the eye without corneal abrasion. So there's quite a bit of conditions and limits. So it's really important that we're consulting this document and consulting the scope of practice for RNs if we're really questioning whether or not we can or cannot implement or carry out the activities. So as we move on to the publication, we get to Section 7, and that's restricted activities that require an order. So the CRNBC talks about this when they say that the restricted activities listed in Section 7 of the regulation and outlined below require an order. An order is an instruction or authorization for a specific client that is given by an authorized health professional to a registered nurse to carry out an activity that includes a restricted activity listed in Section 7 of the regulation. Health professionals are authorized to give orders to registered nurses under the regulation. And these health professionals are dentists, midwives, naturopaths, nurse practitioners, physicians, and podiatrists. So the health professional must also be authorized to provide or perform the restricted activity. For example, an RN would not take an order from a midwife for a medication to treat CHF. And that would make sense because the midwives would not be treating CHF. They would be, that would be something that you would get an order from the patient's physician that is currently treating that patient's heart failure. So the CRNBC talks about the standards for acting without an order, or with an order, sorry, acting with an order. And I'll just go over these just like I did earlier without an order. So this one with an order. Before carrying out an order, RNs must ensure that the order is client-specific, made by a health professional authorized to give an order to an RN, ensure that the activity is within the scope of practice for RNs as set out in the regulation, congruent with any limits or conditions established by CRNBC, and within any restrictions imposed by the organization policy. The RNs must have the competence to carry out the activity safely and ethically, manage the intended outcomes of the activity and recognize the unintended outcomes of the activity, and implement a plan for dealing with these unintended outcomes. So if we take an order, we wouldn't be able to carry out things like endotracheal intubation, like as the example that was made earlier as well. The RN must take appropriate action if the order does not seem to be evidence-based, or if it does not appear to consider individual client characteristics or wishes, if there's any contraindications for the intervention based on the individual client. and we must be able to obtain the client's consent prior to administering an order, like packed red blood cells. Now we move on to Section 8, Restricted Activities with Certified Practice. So Section 8 of the regulation outlines restricted activities are subject to additional regulatory provisions highlighted and discussed below. So if we look at the publication, we'll see it below this here. Before carrying out the restricted activities, registered nurses must complete a certification program approved by the CRNBC. So it would be certified practice for RNs. So it says here, as an example, or as one of the sections actually, a registrant in the course of practicing nursing may do any of the following: perform an activity based in Section 7, which is restricted activities without an order, except compound, dispense or administer a drug specified in Schedule 1A of the Drug Schedules Regulation. That's something that you can have a look at in terms of the schedule of drugs and pharmacotherapy. Make a diagnosis identifying a disease, disorder, or condition as the cause and signs of a symptom of the individual. So like I've mentioned earlier as an example, certified practice in reproductive health, you would be able to, as a certified practice RN, you'd be able to identify an STI, make a diagnosis based on the conditions and the signs and symptoms of the individual. So the CRNBC talks about 3 certified practices within British Columbia, and there's the certified practices categories and education requirements are listed in Table 2 of the publication the CRNBC has published on their website. So the 3 certified practices are remote practice, RN first call, and reproductive health. The first one, remote practice, you'd be able to diagnose and treat minor acute illnesses set out in the decision support tools, including administering, compounding, or dispensing Schedule 1 medications without an order, and carry out all activities including reproductive health and certification. So that sort of includes the reproductive health certified practice aspect in remote practice, especially because in remote practice you would see limited resources and limited ability to consult different healthcare professionals like MDs and nurse practitioners. RN first call, that's another certified practice. You'd be able to diagnose and treat minor acute illnesses, including administering, compounding, or dispensing Schedule 1 medications without an order as set out in the decision support tools. And the third one, reproductive health, to diagnose and treat sexually transmitted diseases, provide birth control. STIs only to diagnose and treat sexually transmitted diseases, and contraceptive management only to provide birth control. So the CRNBC talks about delegation as well in part 4 of the publication on the CRNBC scope of practice for registered nurses. They identify and define delegation as delegation means sharing authority with other healthcare providers to provide a particular aspect of care. Delegation to regulated care providers occurs when an activity is within the scope of the delegating profession and outside the scope of the other profession. So it states that the Health Professions Act states that the delegation of a restricted activity by an RN must be in accordance with the CRNBC bylaws, and delegation of a restricted activity to a registrant must be in accordance with the bylaws of the Registrants College. The Act also says that the government may establish restricted activities that must not be delegated. So things that RNs would be able to delegate should be within the scope of practice of whoever you're delegating to. So if an RN is delegating a task to an LPN, it must be within the LPN scope of practice. So the RN must be aware of their scope of practice to ensure that they're delegating within the Health Professions Act. The Act also says that the government may establish any limits and conditions that apply to delegation of a restricted activity. So the CRNBC also talks about standards for delegating to RNs, and this is found in just below Part 4 of the CRNBC scope of practice, and can be accessed through the CRNBC website. And there's 11 standards that are listed for delegating to RNs, and it's important that we have a look at that, especially when we're receiving delegation from physicians and nurse practitioners, to ensure that we are practicing within the nursing scope of practice, especially when there's a restricted activity that's being delegated. Also included in the rest of the publication by the CRNBC are appendices to the scope of practice of registered nurses, with and without acting in order, standards for delegating to registered nurses, as well as CRNBC limits and conditions. And it's important that we consult this document to ensure that we're practicing within the scope of practice. To wrap up, I just want to again refresh where this document is in case that you need to access it for your own practice. It's at the crnbc.ca website, so www.crnbc.ca, and if you click on nursing standards, it'll give you a link for the RN scope of practice. And once you click on RN scope of practice, this is a PDF file that says scope of practice for registered nurses. Once you click on that, the PDF file should download and you should be able to view that. Thank you.